Okay, good morning. Once again, we've seen no new cases across the Murrumbidgee region now since the 17th of April. So we're approaching nearly 8 weeks of having no new COVID infections in our region. But I think we need to remind ourselves the virus sadly has not gone. Across the world, there's been 7.9 million people infected with the COVID virus. And even in Australia, where we've seen 7,320 people infected, and New South Wales, 3,134 people. And only in the recent weeks, we've seen 3 new suspected community transmissions in Sydney. So the message is, while we've moved into this new phase of the COVID-19 virus, we will need to live with it for quite some time going forward. 50 people have lost their lives in New South Wales, and sadly we remember that one person in our region has also lost their lives. So what does that mean for us, and what's our job in health? So the first job for us is to ensure that we want to keep you and support you to sustain your health during this period. It's really important that you see your GP if you're crook, and make sure that you look after yourselves. The second thing we are all working together with the New South Wales Police is to protect our community. And then finally, our response in health to look after any outbreaks that may occur in our region. So that's our job. So some really good news around testing. So part of protecting our community is to keep testing so that we can check to see if there's any of the virus in our region. So the numbers are really growing. We've now tested over 13,500 people in our region as of today, which is fantastic, and I absolutely applaud those people who have come forward to be tested. Don't wait for our testing van though to come to your town. There's lots of ways of now accessing tests. And our van is still travelling around the region. So this week it'll be in Leeton, it'll also be in Culcan, Holbrook, and then later in the week over in all of the smaller communities around the West Wyalong region. But there's one way to find out how to access a test near you, and that is to ring our COVID hotline number on the Murrumbidgee website. We will link you in with either a GP or a respiratory clinic run by the general practice or one of the district's testing clinics or the mobile clinic. So give us a call if you've got any symptoms at all, sore throat, fever, cough, make sure you give us a call and come forward for testing. Really important message I'd like to talk to people about today, and that is how to get you out of home isolation quicker once you've had your test. So we've got a great option of you receiving your results via text message, but only half the people across our region are currently opting for that. We'd really like to increase the numbers of people opting in for the test results. It means that within 30 hours we will text you your results, and that means you can get out of a self-isolation sooner and back to work if your symptoms have gone away. So use the text result option. It's a really good result for you. Inside our hospitals, things are still looking quite different. To start with, we are maintaining that extra capacity in our intensive care units, along with those specially trained staff maintaining their skills, and all the additional equipment is still coming, including ventilators. But if you walk inside the emergency department, you'll notice big differences. We are retaining the respiratory zones in the ED and also on the wards. We have to do that where we can cohort patients who are awaiting their tests. So people in the hospital will continue to see our nurses and doctors fully dressed up in their protective equipment to make sure that we keep people safe while we're waiting for people with respiratory symptoms to get their test results back. Also, anybody visiting our hospitals will still be undertaken, have screening undertaken. That includes a temperature test and registration of your details, and also we ask you to complete some questions. If you're not sure about whether you can visit our hospitals or not, just give your local hospital a call and we'll let you know. So at the moment we're revisiting our visiting restrictions, and we're looking to increase the number of people who will be able to come into our acute hospitals. Currently, each patient's just got the one designated visitor for an hour a day, and we're looking at now expanding that so that 2 people can come for up to 2 hours a day. And we've already rolled that out across all of our residential aged care facilities. That's really important so that we can connect those residents with their family and their loved ones. And they've been really appreciative of that. And finally, surgery. So during the COVID pandemic, the National Cabinet recommended that non-urgent elective surgery be deferred while we treated the pandemic patients. Now in Murrumbidgee, over the recent weeks and months, we've been reintroducing those non-urgent surgeries, and we really want to get on top of people who may become overdue for their surgery. We made a commitment last fortnight that we'd get up to 75% of that deferred surgery by the 30th of June. And I'm really pleased to announce today that we have reached that target. We are now doing that 75% of the deferred surgery, and we're now planning to do 100%, so resumption of all of the elective surgery. You may have noticed today that the Premier has made a commitment to support hospitals in New South Wales resume their surgery, and also to address patients who may become overdue in the next 6 months by some collaborative work with private hospitals. And we want to thank the private hospitals in our region. During this whole COVID pandemic, we've worked really closely with a number of them, and they have been already supporting us do some of our surgery. And we'll be in continued discussions again around how we can do this next bubble of surgery over the coming weeks and months. So we do give a commitment to our patients who may become overdue for their surgery in the coming weeks and months that we will look to completely remove our overdue patients by the end of the year. That's really important for people who have been patiently waiting. The people who we're looking at addressing first are people who are orthopaedic patients and patients awaiting some urology procedures. So we're working along with our surgeons to work all that out now, and it's good news, I think, for the people across our region. So we'll just keep on working with our hospitals, with our communities, and we just urge you to come forward and get tested should you have any symptoms of COVID-19. It's pretty tough during winter. There's lots of colds and flus going around, so we're seeing people coming forward now for repeat tests. So again, every time you get the symptoms of a respiratory illness, we urge you to come forward. Again, thank you everybody in our communities, our businesses, for the work that they're doing to protect our communities. Thank you. Thanks. Bob, I'll introduce you to Bob.
Thanks.